So remember, there are 9 patterns we have to remember about the heart. 9 patterns. 5 plus 4. Got it? 5 patterns are deficient pattern. 5 पैटर्न हार्ट की कमजोरी से होते हैं. 3 पैटर्न आर एक्सेसिव पैटर्न and 1 is mixed, which include 100 disease connected with the heart, whether you are not able to sleep, or the mouth ulcer, or the palpitation, or the enlargement of the heart, or the collapse of the heart, profuse sweating. So all the pattern, or the shrinkage of the heart, whatever the disease happening because of the heart, coming in these 9 patterns. हार्ट की कोई भी डिसीज होगी, चाहे वो हार्ट की होगी, चाहे वो हार्ट से कनेक्टेड होगी, इन 9 पैटर्न्स में आ जाएगी. What is the meaning of connected disease? The meaning of connected disease, like mental retardation, like the memory loss, like the aphasia, someone is not able to speak, aphasia, connect with the heart. Okay, like the person is speaking a lot, schizophrenia, these all problems, there are many more problems, all will come in the heart. Number 1, chi deficiency, means heart chi deficiency. Number 2, heart yang deficiency. Number 3, heart yang collapse. Number 4, heart blood deficiency. And number 5, heart yin deficiency. Only 5 patterns. These all the 5 patterns are written here. You can see the pattern number 1 is heart chi deficiency. The pattern number 2, heart yang deficiency. The pattern number 3, heart yang collapse. The pattern number 4, heart blood deficiency. And the pattern number 5, heart yin deficiency. These are the 5 patterns of heart of the deficient condition. So long standing sadness and the suppression of the emotions are also responsible for heart chi deficiency. So number 1 cause, sadness. We can tell sadness because of any reason. तो पहला कारण है कि लंबे समय तक दुखी रहना. अगर आप खुश हैं तो आपकी एकदम से हार्ट ची बढ़ जाएगी, और अगर आप दुखी हैं तो आपकी हार्ट ची कम हो जाएगी. इज द कॉज नंबर 1, sadness. It's written there. The cause number 2, have you seen what is the difference between child and the old person? Child of 5 to 8 years and the old person of 70 years. What is the difference? The child always want to play and laugh. Old person neither want to laugh nor allow to laugh. तो बच्चे तो खेलना चाहते हैं और हंसते मुस्कुराना चाहते हैं, और बुढ़ापे में लोग ना तो हंसते हैं ना हंसने देते हैं. You're right. Many, I'm not talking about each and every person, but I'm talking about the many of the persons. Okay, many of the persons in the old age, people are becoming sad. Sometimes it's becoming very difficult to bring the smile on the face. So the factor number 2, old age, is responsible for the heart chi deficiency. That is a natural heart chi deficiency. So that's why when you are going to the kids, you are smiling. Wow, because a smile is transferring from kids to you. But when you are sitting among the old people, like maybe 10, 12 old people are sitting around you, you become very serious like them. Okay. तो कहते हैं कि जो मुस्कुराता है वो बच्चा है, वो जवान है, और जो हमेशा गंभीर रहता है वो बूढ़ा है, किसी भी उम्र में, at any age. So why the heart chi is getting deficient? The cause number 1, sadness. The cause number 2, old age. And the cause number 3, bleeding. If the bleeding is happening, suppose accidental bleeding, or because of some reason internal bleeding, then also heart is getting deficient. So there are 3 causes of the heart chi deficiency. ये 3 कारण है heart chi deficiency. The pattern number 2 is heart yang deficiency. And the pattern number 3 also the heart yang deficiency. Or the pattern number 3, heart yang severe deficiency. Heart yang severe deficiency. Or we can tell collapse. So what is the difference between heart yang deficiency and heart yang collapse? आखिरकार इन दोनों में क्या अंतर है? What is the difference between these two conditions? आपने देखा है, कुछ लोगों को देखा है जो हमेशा सैड रहते हैं, या चलो सैड ना रहते हो लेकिन कभी मुस्कुराते तो नहीं. Have you seen? Okay. आपके घर में तो नहीं है ऐसा कोई? है ना? Okay. अड़ोसी पड़ोसी कहीं ना कहीं होगा. So the person first getting heart chi deficiency. Now slowly and slowly, because heart chi deficiency means heart is, the person is very sad. Sadness means yin personality. देखो दो तरह की पर्सनैलिटी होती है, एक होती है yang personality और एक होती है yin personality. Yang personality means jolly personality, smiley personality, laughing personality, loud personality. That is yang personality. Aggressive personality, that is yang. तो yang personality का मतलब है थोड़ी aggressive टाइप की पर्सनैलिटी, जॉली, स्माइली. और कभी कभी yang पर्सनैलिटी परेशान भी करती है कि फोन पर बात करेगा तो चिल्ला चिल्ला के आपके कान बजने लगेंगे. So sometimes yang personality also creating the trouble. Some person talking in front of you very loudly and troubling you. So yang personality like that. And yin personality less talkative, sad, just thinking inside, worrying and doing the anxiety. yin personality का मतलब है कि एक्सप्रेस नहीं करता, वो अंदर ही अंदर सोचता रहता है, एक्सप्रेस नहीं करता. Introvert type is right. Introvert type. Okay, introvert. So suppose someone is already having heart chi deficiency. The heart chi deficient person will be not expressing. वो एक्सप्रेसिंग नहीं होगा, वो कुछ एक्सप्रेस नहीं करेगा, वो अपनी चीजों को अंदर ही रखेगा, दुखी रहेगा, परेशान रहेगा, है ना, दुखी और परेशान रहेगा. और लंबे समय तक जब ऐसा बना रहेगा तो आगे चलकर उसकी बॉडी ठंडी होने लगेगी. द पर्सन विल बिकम कोल्ड इन द लॉन्ग टर्म बिकॉज हार्ट इज द सेंटर ऑफ फायर. Heart is the center of fire. Heart is the center of yang. Heart is the, in the 5 element cycle, heart is fire. So when the person having long standing sadness, when the person is having heart chi deficiency, in the long term become heart yang deficiency. तो अंतर क्या हो गया भाई? हार्ट chi deficiency था पहले तो दुखी रहता था, अब हार्ट yang deficiency होगी. अब क्या अंतर हो गया? हाँ, yang deficiency होगी. yang means heater of the body. अब बॉडी ठंडी हो जाएगी उसकी. The body will become cold. So remember 2 things about the yang. Number 1, yang is the heater of the body. Who is keeping your body warm? तो पहली बात तो है yang आपके शरीर का हीटर जो आपकी बॉडी को गर्म रखता है. The second, yang is means moving and circulation. Who keep the very wonderful circulation? yang का दूसरा काम है कि सर्कुलेशन को बनाए रखना. तो yang की डेफिशिएंसी होगी तो सर्कुलेशन कम हो जाएगा, तो सूजन आ जाएगी. जैसे बहता हुआ पानी पीने लायक होता है लेकिन रुका हुआ पानी पीने लायक नहीं होता. The flowing water can be drink, but this formula is not applicable in the city. Water is very dirty, so don't take it seriously. Now you start drinking the water in the in the river of city. It's very dirty water. Okay. तो बहता हुआ पानी स्वच्छ माना गया है, लेकिन कहां से? जब तक उसमें कचरा नहीं डाला गया. लेकिन रुका हुआ पानी पीने लायक नहीं होता. We know that. In the same way, when yang is good, everything is moving, and body is very clean and super. But yang is deficient. Now swelling will start, gathering will start. yang कमजोर हो गया, अब सूजन स्टार्ट होगी. ओके, सो पहले तो हार्ट ची की डेफिशिएंसी हुई. हमारे पास एक पेशेंट आते हैं, वन पेशेंट कमिंग टू अस. ही लिव्स इन बड़ोदरा, गुजरात. His son also lives in Vadodara, Gujarat. But both live separately. They never talk to each other because of some conflict and all. So parents are always in the sadness mode, always in the sadness. I have seen them in the 3 years back. They were having only sadness mode. But now after 3 years, they become cold. Why? Because 3 years back, they were having heart chi deficiency. Now they are suffering with the heart yang deficiency. You're getting my point? Heart yang deficiency. तो 3 साल पहले वो दुखी थे क्योंकि उनके बच्चे उनके साथ नहीं रहते, दोनों में कॉन्फ्लिक्ट है. और 3 साल पहले तो वो सिर्फ सैड रहते थे, तो हार्ट ची की कमी थी. अब तो हार्ट यांग की डेफिशिएंसी हो गई. Now it becomes very difficult because the person who is suffering with the heart yang deficiency, यानी उसके शरीर का हीटर खराब हो गया है. ऐसे व्यक्ति के ऊपर अगर आपने एक बाल्टी ठंडा पानी डाल दिया तो बीमार पड़ जाएगा. Because person is already not having good heater. Now you put 1 bucket cold water, he will become ill because he doesn't have immunity to fight with the cold thing. ठंडी चीजों से लड़ने की ताकत नहीं है. Once you are suffering with the heart yang deficiency, you cannot fight with the coldness because you are already cold. You cannot survive in the coldness. आप ज्यादा coldness में survive नहीं कर सकते. Fine. So in this way, in the same way, I will tell you, one female is living with whole family, but there are lots of conflict, quarrel is going on in the home. So she is suffering with the heart chi deficiency. Sadness, always sadness. She never smile. How can she smile? Because always quarreling in the home. तो एक फीमेल है जो हमेशा दुख में, कष्ट में रहती है, हमेशा लड़ाई झगड़े की बातें. So now after 3 years, she was suffering with the infertility and body become cold. So anyone, the first is getting heart chi deficiency, and slowly he may convert or she may convert in the heart yang deficiency. Means now your heater will not work. If your heater will not work, then you are no more fertile. Fertility gone. अगर आपके शरीर की गर्मी कम हो गई तो ओवुलेशन ही नहीं होगा, है ना. ओवुलेशन ही नहीं होगा तो फिर फर्टिलिटी नहीं रह पाएगी. So second condition is yang deficiency. Now if yang deficiency is constant, suppose the person is suffering with a yang deficiency. Now this person is taking cold water bath every day. Suddenly he might suffer with the yang collapse. Okay, अगर ऐसे व्यक्ति जिसकी ऑलरेडी हार्ट यांग डेफिशिएंसी है, शरीर पहले ही ठंडा है और सडनली उसने एक दिन तीर्थ स्थल में जाकर ठंडे पानी से स्नान कर लिया, उस एक दिन में ही उसका यांग कोलैप्स हो जाएगा. Only on that day the person will suffer with the yang collapse because yang collapse is happening quickly on the one day. I have seen one patient and my student both together. He went to one tirth sthal, took the spring water bath, same day got the yang collapse. उसी दिन उसका पूरा शरीर नीला पड़ गया, ठंडा और नीला. yang collapse means blue lips. जब बॉडी ठंडी होती है, डेड बॉडी जैसी हो जाती है. So when body become too cold, it's like a dead body. Fine. So 3 conditions coming after one after another: heart chi deficiency, heart yang collapse, heart yang deficiency, and heart yang collapse. Getting? Now, the tongue is getting energy from the heart. So if the heart chi deficiency, sometimes we are getting heart chi deficiency temporarily. Temporarily means, suppose उदाहरण के लिए निमिषा जी गई पेशेंट देखने और पूरे दिन उन्होंने खूब सारे पेशेंट देखे और रात को थक गई, तो इसे कहेंगे हार्ट की डेफिशिएंसी हो गई. इट्स नेचुरल विद एनीवन, with you, with me, with everyone. So whole the day you are speaking. So you are consuming the energy of heart, and till the night your energy got consumed. Now आपका सिलेंडर खाली हो गया, गैस का सिलेंडर खाली हो गया. Now you are suffering with the heart chi deficiency. Now you will sleep or you will meditate. Again you are regaining the heart chi. आप फिर से कोई अच्छा गाना सुनेंगे या योग निद्रा करेंगे या सो जाएंगे तो सुबह तक आपकी हार्ट की डेफिशिएंसी वापस ठीक हो जाएगी, है ना. बट समटाइम व्हाट्स हैपनिंग, this is very common with the doctors. I will tell you, the very common with the doctors. Many doctors are suffering with the heart attack. You know, many acupuncture doctors are suffering with the heart attack. I have seen, not right now, but 7-8 years back, I have seen. Because acupuncture doctor, throughout the day, they are just, if they become very famous, if they are not famous, then they are fine. But if they become famous, then throughout the day, they are just treating the patient. And 1 day, 2 day, 1 year, 2 year, in many years, heart chi consumed completely. Heart chi completely. But still they are working because they have to work. I have seen two acupuncture doctor got paralytic attack. 2 acupuncture doctor. 7 years back. 7 साल पहले. Why? I have seen the cardiac doctor, allopathic doctor, MD doctor was driving the car. Just in front of his hospital, heart young got collapsed, expired. So remember one thing, when you are speaking a lot, when you are counseling a lot, you are consuming the energy of heart. तो जब भी आप बहुत ज्यादा बोलते हो तो आपके हार्ट की एनर्जी कंज्यूम करते हो. तो कहते हैं कि थोड़ा तो बोलना भी चाहिए, लेकिन बहुत ज्यादा ही बोलते हो तो हार्ट अगर खाली हो गया पूरा, ठीक है, अच्छी बात है, बट स्टिल यू आर स्पीकिंग बिकॉज यू हैव टू स्पीक as per your profession, then you will suffer with the heart deficiency. Then you are going to, how to restore? Just shut down all the activity, close your eyes, listen your favorite music, or take the guitar in your hand, or do whatever you randomly. So just what heart likes? Heart likes music, heart like love. Okay. So with that thing you can refuel the heart. So look at here now. So the second condition is heart yang deficiency, and the third condition is heart yang collapse. So remember here. So when the person is suffering with the heart chi deficiency, it's a condition number 1. Then the person is getting heart yang deficiency, it's a condition number 2. Then the person is suffering with the heart yang collapse, it is a condition number 3. ये हमारी तीसरी condition है. So heart is connected with the sweating. In all the three conditions, if the person is having poor heart, then will be sweating a lot. अगर व्यक्ति का हार्ट कमजोर होगा तो पसीना बहुत आएगा. And sweating either day or night, no problem, means there is a no botheration, there is a no limitation with the day and night. Person will sweat anytime. So person will be sweating here, person will be sweating here, person will be sweating here. But if the yang is collapsed, then there will be profuse sweating. Profuse sweating. तो अगर कभी आपको लगे, sweating is the very important diagnostic tool, the number one diagnostic tool. Suppose आपने कहा कि पानी लेके आओ, किसी को बोला पानी लेके आओ, bring the water, 1 glass water for me. He brought 1 glass water from the kitchen and sweating. It means heart she is deficient. But also see the weather. Okay, weather, if weather is hot, then it's natural. So person having heart chi deficiency, even sweating under the air conditioned room में भी sweat करता है, right? The person is going from one room to another room and sweating starts. Very little walk, sweating start. So that is a sign of heart chi deficiency, because heart is controlling the water. We will discuss this thing, how the heart is controlling the water. So when the person is having heart collapse, profuse sweating, whole the cloth become wet, सारे कपड़े गीले हो जाते हैं, from top to bottom fully wet because of the heart yang collapse. तो कभी किसी को बहुत पसीना आए तो देख लेना कि कहीं हार्ट की ची कमजोर तो नहीं हो रही है, और हार्ट की ची कमजोर होगी तो अभी हम प्रोटोकॉल की बात तो करेंगे. We will discuss about the protocol, but right now I will tell you just 2 points. One source point, source, and second backsu point will improve the heart. Source point means heart 7, backsu point means UV 15 will improve the heart. But we will see the protocol of heart chi deficiency, heart yang deficiency, heart yang collapse. We will see all the protocols. Okay, so I'm not talking about the sweating on the forehead, no. Sweating whole body. Sweating whole body, especially, heart meridian starts from axilla and ends here. So there will be too much sweating from the axilla. Heart meridian axilla से start होता है, तो too much sweating will be axilla. अब इसका मतलब ये नहीं कि आपने कहा कि आज मैं सुबह 1 किलोमीटर दौड़ लगाने गया, खूब पसीना निकला, तो क्या हार्ट कमजोर है? जी नहीं. If you are running 1 kilometer and you are sweating, it's a natural. Okay, so do not do the comparison with that thing. The sweating because of the heart condition means without any reason you are sweating. I have seen one patient who has done mitral valve operation, जिसने अपने हार्ट के mitral valve का ऑपरेशन करवाया है. The lady is sweating even in the air conditioned room. Whenever you see, this is sweating. Okay, so sweating is the sign that person is having poor heart. The functioning of the heart is poor. And remember one thing, if the heart is poor, it will also affect the lungs. And the lung is poor, it will also affect the heart. अगर हार्ट कमजोर है तो आपको लंग पर प्रभाव दिखेगा, और लंग कमजोर है तो आपको हार्ट पर प्रभाव दिखेगा. So heart is poor, you will also see many symptoms of the lung, like the breathlessness, like the breathing difficulty, even the vice versa. Okay, then you will get confused, oh, whether the problem is the heart or in the lungs. So definitely if heart is poor, then there will be many symptoms will be visible of the lungs. तो जब किसी व्यक्ति का हार्ट कमजोर होता है ना, वो भी आपको पंप लेता हुआ मिलेगा. Even the person having heart chi deficiency will be taking the inhaler. Why? Because going to doctor, I'm suffering with the breathlessness. I'm going from one room to the another room and I'm getting the breathlessness. So doctor are giving inhaler. Okay, take this. You will be, now your life will be very smooth. Take the inhaler. Okay. The डॉक्टर उसको बोल देते हैं कि भाई इनहेलर लेना चालू कर दो, क्योंकि breathlessness because of any reason, whether the heart or the lungs, the treatment is inhaler. So the sign number 1 of any types of the heart deficiency, that is sweating, पसीना निकलना. Okay. So now, so this is the symptom number 1. Now this person will be very sad. ये पहला व्यक्ति बड़ा दुखी होगा. So this first person will be having too much sadness. The second person will be having cold body, because cold body is the sign of yang deficiency. And the third person will be having cold as well as blue body, blue lips. Blue is the sign of coldness. हम जानते हैं कि अगर किसी को बहुत ठंड लग जाए तो शरीर कैसा ब्लू हो जाता है, नीला पड़ जाता है. If the person is getting too much coldness, अगर व्यक्ति के शरीर में कुछ ज्यादा ठंडी लग जाए तो या तो काला या नीला पड़ जाता है. Person is becoming black or the blue. In the third condition, person is becoming black or blue. So in this condition, there are 3 things we need to remember. So the heart deficiency because of the sadness, because of the bleeding, and because of the old age. ये 3 कारण है heart deficiency के. Heart yang deficiency also because of the sadness for a long time, bleeding long time, and old age. This is also the responsible for this. Means when the heart chi deficiency for longer duration, it will become heart yang deficiency. और इसमें क्या होगा? इसमें body will be cold body. Fine. Now third condition, I told you, in the third condition, this will be collapse. Means अगर कि कोई व्यक्ति ने ठंडे पानी से नहा लिया, if the person is taking the cold water bath, if the person is living suddenly in the cold atmosphere, suppose कोई इंडियन व्यक्ति है एकदम से कनाडा चला गया और कनाडा की ठंडी में उसको पहले से यांग डेफिशिएंसी थी, तो कनाडा की ठंडी में अब उसका यांग कोलैप्स हो गया. So person living in the India suddenly went to Canada, and in the cold weather of the Canada now suffering with the yang deficiency. So in this condition there might be many causes. So when the person is having yang deficiency, the moxivation is the very good treatment. हम उसको मोक्सा कर हीट ट्रीटमेंट देकर उस पर्सन को रिवाइव करते हैं. We are doing revival of the person. So when the person is getting yang collapse means person is collapsing down. Collapse का मतलब है कि person एकदम collapse हो जाता है. Even person might go in the coma. So now remember 3 things. Number 1, heart chi deficiency. Number 2, heart yang deficiency. Number 3, heart yang collapse. So heart chi deficiency is a normal sadness and all. Heart yang deficiency means these things for prolonged time. So this person is getting heart failure. इस व्यक्ति को heart failure हो जाता है. And this person is also getting the heart failure and also might go in the coma or also might suffer with the paralysis and all or the stroke. So these are the 3 conditions. ये 3 conditions. तो चलिए ना, अब हम पूछेंगे, अभी हमें दो कंडीशन और समझना है, दो कंडीशन और समझते ही डेफिशिएंसी पैटर्न खत्म हो जाएगा. सो वी हैव टू लर्न two more condition as soon as we learn the deficiency pattern will completed. But right now what we have learned, it's a more common with in the old age. अभी तक हमने जो समझा है, this is the more common in the old age, but this also might be common in the middle age if the person is sad. ये मिडिल एज में भी हो सकता है कि अगर व्यक्ति सैड है. Many females, when they are emotionally breakdown, passing through the emotional breakdown, might suffer with the heart deficiency, then the heart yang deficiency, even the young female, even the male. Okay. So these three patterns. Now the fourth pattern is heart blood deficiency. Okay, and the fifth is heart yin deficiency that we know. तो अब हम चौथे पैटर्न की बात करते हैं, हार्ट ब्लड डेफिशिएंसी. हार्ट ब्लड डेफिशिएंसी को कहते हैं द पैटर्न ऑफ यंग फीमेल, द पैटर्न ऑफ यंग फीमेल. हार्ट ब्लड डेफिशिएंसी मींस द पैटर्न ऑफ यंग फीमेल और द मिडिल एज फीमेल. व्हाट्स हैपनिंग? सपोज आप बताइए, आप सभी लोग, all of you are reading a book or the sitting in the clinic looking the patients, or maybe you will start seeing the patient after few months, या तो आपने अभी चालू कर दिया या करने वाले हैं. So most of you are not sleeping prior to 12 o'clock, am I right? How many of you are sleeping before 12 o'clock? कितने लोग हैं जो 12 बजे के पहले सोते हैं? Most of you are not sleeping. I think 20, yeah, few person will be sleeping, 20% people will be sleeping before 12 o'clock, but 80% people are not sleeping. देखो, 1 2 3 4, there are 4 5 people are out of many. Okay, so Neeta ji, maybe Renu ji, because Renu ji following art of living, so maybe morning getting up and doing Sudarshan Kriya and all. Even Nimisha ji, she is also doing Sudarshan Kriya. But many person are getting up late and doing the Sudarshan Kriya, because Sudarshan Kriya, in the Sudarshan Kriya, it's not recommended that you should do in the Brahma Muhurta. You can do any time in the morning. Yeah. Okay, it's wonderful. You can do any time. So most of you are sleeping after 12 o'clock, even near around 1 o'clock, 1 baje. So the person who is sleeping 1 o'clock for longer time, suffering with heart blood deficiency. This is the pattern. This is the biological pattern. Why? What is the connection with the time and the heart blood deficiency? तो जितने भी डॉक्टर हैं वो भी बीपी की दवाइयां खाते हैं, वो भी बीपी की दवाइयां खाते हैं, especially females. Why? Number one, female are losing the blood every month during the menstrual cycle. Okay, males are lucky, they are not losing anything, but female are losing blood every month during the menstrual cycle. And second, they are also getting up till the midnight. 11 to 1 is the time of gallbladder. 11 to 1 gallbladder ka time hai. If you are not sleeping during the time of gallbladder heart are closely connected with the organ clock opposite time. Gallbladder और heart का बड़ा गहरा संबंध है. If you are not sleeping in the gallbladder time, definitely going to suffer with the weakness of the heart. Okay, so heart, especially female, are suffering with the heart blood deficiency in the middle age. Middle age means 30, 35, 40, 45. This is the age, because this is a very struggling age. 30, 35, 40, very struggling age. You have to maintain everything. आपको हर चीज manage करना. You have to manage everything. You have to manage your home, you have to manage kitchen, you have to manage your profession, you have to manage kids, you have to manage your adults, everyone. You have to manage this time. So this is a very crucial time. ये बड़ा crucial time है. इस समय कितना manage करना. So not able to sleep till the 1 o'clock in the night, suffering with the heart blood deficiency. So this is called 1 to 9 pattern, heart blood deficiency pattern, right? 1 to 9, heart blood deficiency pattern. My class is going late because I know you're not sleeping. You're not sleeping. So let's take the class. Okay. Okay. You know, for the Nigeria people, I have taken the class 10:30 to 11:30 for the Nigeria. 10:30 to 11:30. And we were finishing class by 1 o'clock in the night sometime. 1 o'clock in the night. For Nigerian, it was evening. For not for us. Okay. My heart is very good because my heart is filled by love of I'm getting lots of love every day from participants. So sometimes it's overflowing. So my heart is fully relaxed. There is no problem. Okay. Okay, so what, okay, even if I change the time, what is the guarantee that you will sleep on the time? So better to use time. Okay. Fine. Thank you. So the fourth pattern is the pattern of heart blood deficiency. ये चौथा pattern जिसे हम कहते हैं heart blood deficiency. This is the pattern number 4, heart blood deficiency. In the heart blood deficiency, what happening? Person is not sleeping till 1 o'clock or want to sleep but even want to sleep but still not able to sleep. नींद नहीं आ रही. Sleep is not there. Want to sleep but having insomnia. So because of anything, if the person is not able to sleep till the midnight, so this is the very common pattern with the heart blood deficiency. Now in the heart blood deficiency, what will happen? अब ये आप बताइए. If the heart blood will be deficient, so heart is not getting enough blood. Now heart will not able to send the blood here. Then there will be giddiness, dizziness, chakkar आएंगे. So many females are telling, even the evening I'm feeling giddiness, dizziness. Heart is not able to send the blood here. So there will be pain here, and there will be pain here. Many male, female will tell you that I'm suffering with the cervical spondylosis. उनको कहेंगे कि उनको cervical की problem. So when the heart is deficient, heart is not able to send the blood here, 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 here. So the person is tired. So these are the pattern. Even the palpitation. Palpitation is also a very common thing. तो छाती में धड़कनों का बढ़ना, it's a very common pattern. So when the person is suffering with the heart blood deficiency, it's very common that dream disturbed sleep, not able to sleep, and because blood is not going to the brain तक blood नहीं जा रहा है, so giddiness, memory loss, forgetfulness, depression, confusion, and even the palpitation. तो कई लोग इस तरह, especially these people in the evening time, they are telling that they are suffering with the problem. Okay. So now the last pattern, that is the heart yin deficiency. This is the last pattern. So heart yin deficiency. Yin means cooler of the body. Yin means air condition of the body. yin का अर्थ है कि शरीर का कूलर, शरीर का एयर कंडीशन. अभी शरीर का एयर कंडीशन ठीक से काम नहीं कर रहा है. So what's happening exactly? Suppose someone is having heart yin deficiency. So cooler is not working properly. Then body want to cool, then there will be night sweating, night thirst. So the night sweating and the night thirst will be the common sign. और हम जानते हैं कि हार्ट yin deficiency के जो common sign होते हैं, we have seen, learn many times, yin deficiency का जो common sign है 5 palm heat, heat in the palm, heat in the chest, not visible. Oh, no screen. Oh, sorry. No screen. Okay. So the fifth number pattern, heart yin deficiency. Heart is not cool. The air condition of the heart is not working. The cooler of the heart is not working. Then heart will be, this part will be hot. Chest will be hot. Palm will be hot. Feet will be hot. Sweating in the night and thirst in the night. And many persons are feeling feverish in the evening. So these are the 5 patterns, right? ये 5 पैटर्न. Okay, so tell me. Write down the name of all the 5 patterns quickly in the chat box. Write down the name of all the 5 patterns in chat box quickly. I'm giving 30 seconds. 30 seconds. Okay, we will learn more symptoms of every pattern. Let's go step by step. Few people are very expert in the writing. They write very quickly. Wow. Wonderful. Excellent. Wonderful. चलिए बताइए. The patient who might go in the coma belong to which pattern? Coma. कौन से पैटर्न का व्यक्ति कोमा में जा सकता है? कोमा. Question number, the pattern which is very common with the young female, the pattern which is very common with the middle-aged female. Middle-aged female. Middle-aged female. Very common. Which pattern is because of the bleeding due to accident? Which pattern will happen because of the bleeding due to accident? The heart failure, common with which pattern? Heart failure. Or the heart failure. Heart failure. Heart failure is common with which pattern? Heart failure is common with heart yang deficiency or the heart yang coalesce pattern. The person is having dream disturbed sleep. Which person is having dream disturbed sleep? कि इतने सपने आते हैं कि नींद नहीं आती ठीक से. सपने 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 आते हैं ब्लड की कमी से, हार्ट ब्लड डेफिशिएंसी से. ओके, नो प्रॉब्लम. Which pattern is creating mental confusion? Mental confusion. So when the blood is not reaching here, it's create the mental confusion. In which pattern person is having palpitation plus sweating in the night? Palpitation plus sweating in the night. Dream disturbed sleep is common in the heart blood deficiency as well as the heart yin deficiency, both, right? Both person are not able to sleep properly. In which pattern body become cold and blue or black? Lips become blue, body become cold, body become black. In which pattern? Okay, wonderful. The enlargement of the heart is very common with which pattern? Heart enlargement. Cardiomegaly or the heart enlargement. ऐसा कौन सा पैटर्न जिसमें हार्ट का साइज बड़ा हो जाता है? So remember one thing, for the enlargement, who is responsible? Enlargement means एक बच्चा है जो खेलता कूदता नहीं है तो मोटा हो जाता है. खेलना कूदना नहीं मतलब young activity नहीं है. If there is no young activity, then become bulky. So heart yang deficiency is responsible for cardiomegaly. Wonderful. तो जब हार्ट कार्डियोमेगली का ट्रीटमेंट करना हो तो हार्ट yang deficiency का ट्रीटमेंट करेंगे. In the which pattern there is a profuse sweating, too much sweating, profuse, like. So we have summarized the 5 deficient patterns of the heart. Still we have to learn more about these 5 patterns. We will discuss. We will also learn 3 excessive pattern, 1 mixed pattern, total 9 pattern we will learn. So thank you so much everyone. See you tomorrow. Good night.